Let's talk about things that can make a hair transplant more challenging. Usually people come in and they know that a hair transplant is going to take a while, and sometimes they're surprised at how long it actually takes, even for sometimes a smaller procedure. Well, there are different factors that might contribute to making your hair transplant just a longer day for you, for the surgeon, and just also more challenging for the team that's performing your procedure. Scarring can definitely make a hair transplant more difficult to perform. So someone may have had an FUT or an FUE procedure in the past, and now you're doing another surgery and you're working around some of that scar tissue. And that could sometimes even change the direction of the hairs underneath the skin. And so you're going and you're harvesting, and you have to really adjust quite a bit because that scar underneath the surface of the skin can start to alter the direction and the angle of the hair follicles. So you need to be very careful when you go to extract and harvest your grafts that you're adjusting to those variations that might exist because of that prior scar tissue. Also, I find that patients who microneedle often will typically have a firmness to their scalp that might make it more difficult to place grafts. Usually the harvesting isn't as affected because that's happening at the donor area, but at the recipient area, when we go to place the grafts, we find that it can be more tricky to work with that scalp tissue if they microneedle, like say weekly or every 2 weeks, and they've been doing that for years. Now let's talk about changes of direction. When you work on hair, you have to observe the natural direction that the hair takes. And you need to follow that when making all of the sites and when placing grafts in a hair transplant. Some patients have what's called whorls, or cowlicks as it's colloquially known. Having one at the crown is pretty normal and expected, but some patients will have multiple in the crown, or they'll have one or two or sometimes more at the frontal scalp. And that can be tricky to replicate when you're doing a hair transplant. But if you don't replicate it, then things will look less natural when the hair actually grows in. And the challenge technically is being able to make those sites in a circular motion, and that is difficult, and it does slow you down when you're doing the actual surgery. Now, some patients don't necessarily have a whorl pattern, but they might have it where the direction abruptly changes, which is less common. Usually, as the direction of the hair changes, it does so in a very gradual type of way. But some patients have abrupt changes, so you might have an area where everything is pointed one way, and then right next door to that, you'll have the hair running exactly in the opposite direction. Another factor is density disparities. So if I'm working on an area that's quite bare, then I'm deciding how exactly to build up the density. And maybe, say, if we're doing frontal scalp, that frontal inch will have a higher density than the area behind it. But some patients will already have a lot of existing hair, but the hair that's there has a lot of differences in how dense it is in one portion versus another section of it. And so when that's the case, and you're doing a transplant, you need to do your best to try to equalize those densities. And that can be a challenge because you're trying to decide, do I work 2x density into this area, 3x density into this area? So your job is to then take that really dense area, sometimes not even place any grafts into there, to start to work up an area that is quite weak. And so figuring out how to balance those densities can be challenging. And in some patients where their existing hair in, say, the DHT sensitive zones is already quite different in the degree of density that's within that zone that you're going to work into, the recipient area. Now you need to come in with surgery and try to equalize that. So it can be difficult to do that. Bleeding is another factor that can make hair transplants more challenging. Some patients just run thin, meaning they have thinner blood, and they might do everything right. We have a whole list of things we give people in advance of surgery to try to reduce bleeding on the day of their surgery. But even if you follow that list and you make sure to avoid, say, spicy foods, and you're avoiding NSAIDs like Motrin, and you're not drinking coffee, the morning of or the day before, and you're not drinking alcohol and all this stuff, you might still have thinner blood. That might be great for your overall heart and, say, lung and brain health, but when it comes to the surgery, it might make it more challenging, because if we're working in the recipient area or the donor area and there is more bleeding, then of course that's going to slow us down because there's more limited visibility. If I can't see what I'm doing, then I'm going to go slower to make sure that I'm still doing the surgery optimally. But the bleeding can definitely impede some of that progress. And some of the tricks we do during surgery would be to give a patient, say, some additional vitamin K. So we have tablets available that can sometimes help reduce some of that bleeding. Another trick is to use more anesthetic that has higher concentrations of epinephrine, but you need to be careful with your lidocaine levels not to reach toxic levels. Another trick we do is we sometimes will use just saline. We'll inject saline, and that can help clamp down on blood vessels without introducing more lidocaine. Another factor during a hair transplant that might make it more challenging is what's called popping. And popping can sometimes happen during the implantation portion of the hair transplant. So when the grafts are going in and we're placing the grafts one at a time with forceps or implanter pens, some of those grafts can actually start to pop out. So like you place a graft in and then the neighbor might pop out. That can occur if you're working at high density to try to really create good density of hair. That can also happen because the scalp itself is more rigid. And that goes back to what I was saying about scarring and history of microneedling or other kind of scarring conditions. So that's called popping. And we see that, and sometimes some patients are just more prone to that. Sometimes a certain area of the scalp might be more prone to that, but that is something that we see from time to time, and that will of course slow us down, because now imagine you've placed the graft and then like two neighbors pop out. Now we have to gradually, place those other grafts back into their place. Another thing that can make hair transplants more challenging is the quality of the graft itself. There is this concept of slippery grafts. These are grafts that are coated in almost this like slimy mucoid type of layer, and it makes it harder to grasp. And also it increases popping, because as you put the graft in, it sometimes wants to just pop right out because it's quite slippery. So one trick that we use is to actually wash the grafts, and that can sometimes reduce that level of slime that's on the graft and make it easier to manipulate that graft and to control that graft during the placement process. And it's hard to predict in advance who's going to have a slippery graft. It's really only once we start the surgery that we start to get a sense of like, oh, okay, these grafts have a certain quality to them that's a little bit different, and it's a little bit more difficult to manage. And so we need to usually wash them down, clean them up, and then we can have an easier time in the implantation portion of the surgery. Another potentially challenging factor when it comes to hair transplant surgery is non-scalp harvesting. This is taking grafts from areas other than the scalp. Usually the scalp is where we go for our source of grafts. But sometimes either the person has had complete depletion of the scalp, right? They've had prior surgeries, or for different reasons, they might not want to get any hair removed from the back of the head. And so one other option for some patients is to take some body hair. So most often it's in men, we're taking some beard hair. Sometimes we're taking chest hair, and other times we could even take back hair. Some clinics will take arm and leg hair. I don't really like to use that. And there are actually specialized punches that some systems have, like our WAD device has a specialized beard hair punch that is made specifically for harvesting from the beard. It has these slight little adjustments that can improve the harvest capabilities. Another factor that could make hair transplants more difficult to perform is if the patient has local anesthesia resistance. Some patients genetically metabolize lidocaine or lidocaine-like products more readily. So sometimes we ask patients, when you go to the dentist, are you easy to numb? And most people say, yeah, I go numb right away. But there is always going to be a subset of people that don't go numb right away, and it might take double the amount of lidocaine to get them numb. These patients are more difficult to operate on because you can imagine we're used to certain concentrations and dosages of our local anesthesia. And if we place that into the scalp and the patient still continues to feel things, then we need to place more. But then at some point you could reach toxic levels. So it becomes a difficult balance. And there are some patients where they'll continue to still feel a little bit. And obviously, we need to be more careful when we work with patients like that because we don't want them to be uncomfortable throughout the surgery. So there's always this balance of adding more anesthesia, not going into toxic levels, but also keeping the patient comfortable. Also, if someone's had prior surgery, the scar tissue that may have formed could make it more difficult to numb them. It's much more difficult to numb a patient in scar than it is in just a healthy scalp. So we end up using more anesthesia for the patients who do have some degree of scarring than for those who don't. And when we talk about things that could make hair transplants more challenging to perform, we need to include the movement of the patient. Most patients stay very calm and composed throughout the surgery, but I do get some patients who like to move around a lot. They might like to just talk a lot, and that can also cause movements, or they're very fidgety with their legs, and we always remind them that the legs are connected to the head, so as they start moving their legs around, the head's going to move around a little bit too. So we often ask to limit the conversations, especially in more important critical parts of the surgery. Some patients also take a lot of breaks during the surgery because they need to go to the restroom or they need to stretch, and we welcome that, but that can of course lengthen the procedure as well. But balancing that with being able to efficiently get through the surgery, so it's not about us going home at a reasonable time, it's about getting those grafts that we've harvested back into the scalp as quickly as we can, because we know that that helps with survivability of the grafts, and it also just helps the patient get through the actual course of the day, because at some point patients can get restless because it's been a long procedure. So those are the different factors that are involved with hair transplant surgery as far as things that can complicate it and make it more challenging to perform. So as you look to decide on which hair transplant clinic might be right for you, make sure that the clinic that you go with understands some of these challenges and has ways of adapting to them, because you never know if you're going to be one of those patients where one of these factors might come up.